Hello. Today is Autism Awareness Day and April is celebrated as Autism Awareness Month. So let us know about autism. I am Dr. Aloka Hedau. I am a pediatric ophthalmologist and a squint surgeon. I see a lot of cases of autism in my practice. Autism is a neurodevelopmental disorder which causes poor communication and interactive ability with these children, having restrictive and repeated behaviors seen early in life, less than 3 years of age group, is autism. Now, autism comes as a spectrum. It can be mild, moderate, or severe autism. What are the signs of autism? Most of the time, these children have poor eye contact. They have inability to communicate clearly. They avoid direct viewing at any object, and most of the time use the parent's hand or caregiver's hand to show objects or to point out to objects of interest. They usually play alone, do not interact with other children similar age group, and they try to avoid any role playing. They usually are left looking at objects which are repeatedly in motion, like wheels of a car or movement of the fan. These kind of repeated motions actually excite them and they like looking at these objects. They're extremely sensitive to touch or sound. Even routine sounds in our households like a whistle of a pressure cooker can actually trigger them. So they avoid playing in places where there is a lot of sound and lot of light. Most of the time they hate bright light, and we see them retracting and going away wherever there is any loud triggers. These children are identified usually by general pediatricians in their routine well baby checks. As young as 18 months baby or even younger can be identified by a good developmental pediatrician for autism. There are a lot of questionnaires which are now available, one of them being MCHAT questionnaire, which are used in the pediatrician practice to identify autism. There is no blood test or a brain scan which can identify autism. So autism is a disorder which is identified based on the observation of the parents as well as developmental pediatricians and therapists. But make sure that you know that autism is not an end-all label to the child. Autism can be improved and many children can easily work in the natural schooling environment at later stages with early intervention. In my practice, I see a lot of eye signs in autism. One of the major symptoms which is even picked up by parents is poor eye contact. The child does not see the object when the object is moved in front of the eyes. They either do a side gaze or they look at some alternate object instead of seeing at that same object. Many of times these children are super sensitive to bright light and they hate going out in the sun. A lot of children with autism also have squints or inward or outward deviations of the eyeball. Many a times I see that all the routine eye problems that we see in other children like myopia, hypermetropia and astigmatism go very long unnoticed in these children because of the fear of parents for bringing them for an eye checkup. A normal misunderstanding is that children will not cooperate for the eye checkup. But please understand that no pediatric ophthalmologist requires cooperation from the child. Any age group child with any level of autism, we can do a detailed eye evaluation with our skills. So please do not hesitate to bring your child for a routine eye checkup every year because unidentified eye problems can go on to become lazy eye or also cause loss of vision. In Dr. Aloka's eye care, we are all very trained and sensitive to understand the special needs of autistic children. Right from booking appointments at a time where there are less patients to making sure that the entire experience is smooth and fast tracked for your child is made sure at our clinics. Checking these children with no touch technique, making sure that the entire examination room has less bright lights and less sound is something that we are very sensitized to. We may sometimes tell you to carry home drops which you can put when the child is sleeping, so that a dilated evaluation also happens in the comfort of the child's environment. So do not hesitate to bring the children for a proper eye checkup to any pediatric ophthalmologist at the earliest. Please understand that autism disorder does not have one medicine. So a lot of therapies like speech therapy, behavioral therapy, occupational therapy, vision therapy will be required for these children. In eye evaluation and eye management, we do vision therapy. Sometimes we need to give glasses. We may need some lazy eye treatment, and in some cases we may also need surgical treatment of the squints, which will improve the eye contact of the child. All this can be done very safely with our skilled team. Please understand that there are a lot of alternate therapies or quackery in this group of conditions. Scientific knowledge has improved drastically in this field, and there is no scientific basis to the statement that vaccination or antibiotics or any kind of anesthesia can cause autism. So, in lack of scientific evidence, please do not believe people who tell you to not vaccinate your children, because this is life-saving. Also, stem cell therapy and other kind of metal chelation therapies have no scientific basis, and going for expensive treatment with false hopes can cause more problems to your child. The theme for this year is Empower Autistic Voices and make them thrive, not only survive. We as a society take autism as a disorder and we just put a label. But let us make awareness for this disorder so that these children, they get the right treatment, early intervention, so that they can absolutely lead a normal life. Thank you.